system, that is the muscles related to the body skeleton. Okay, cardiac muscles is related to the heart, and smooth muscles your intestine and all these organs. Basics are there. Okay. Now, the competency based undergraduate curriculum. You are having this thing that you these are the your in the curriculum. Describe and identify various types of muscles under the microscope. Classify muscles and describe the structure, function, correlation to the cell. What is the function of these muscles, and what is the and its correlation. Describe the ultrastructure of muscle tissue. Now, introduction. The property of contractility is well developed in muscular tissue. Now, the myocytes, muscle fibers, cells of the muscular tissue. Muscles are derived from mesoderm. Now, in muscles, sarcolemma is plasma membrane, sarcoplasm is cytoplasm, sarcos means flesh, plasma, the thing in Greek. Sarcoplasmic reticulum is endoplasmic reticulum, sarcosome is mitochondria. Now, when you read the, you have read already the cell, what is the cell, and its ultrastructures, and its the contents. If you download any histology book or anything, but I will tell you, if you have the time, you look into Gray's illustration. Just look. I'm not saying that you read that 35 or 36 edition volume. Don't go into it. But I'm telling you, you get a very good representative figures and this thing. Another thing is that you are reading osteology. You please, whatever book you are reading or text you are reading, you look into the pictures of Gray's anatomy. And you are already, your osteology classes are going on. You just try to know the main features of the specific bone and the main muscles which are attached to it. তুমি যদি, if you can't say where the deltoid muscle is, where the gluteal muscle is, where the tricep muscle is, where the pectoralis muscle is that, I won't go, or any examiner won't go and ask you that what is this muscle, this muscle, or this muscle. Even in the upper limb, when you go in the dissection of the hand, you will find very small muscles, the lumbricals. I have given you a humerus examiner. Now he asks that এগুলো আর জিজ্ঞেস করবে না, তুমি ধরবে पट 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 हिंदी में बोलते ना रटो रटो एकदम humerus बोले दिले humerus upper end lower end what is the anatomical position, what is right side or left side, and if the respective muscle, where is the triceps, it is having 3 heads, biceps. Now from origin to insertion, where it is originating and getting inserted. It has a specific biological role and also the functional role in when it contracts, the different modes of action of the muscles, and it has a liver action also. So you have to, what I want to stress is that today's histology, so you just you see the slide under the microscope, cardiac muscle, smooth muscles, and muscular tissue. Now, I am trying to say that we have to correlate, then learning becomes easy. তুমি জাস্ট মুখস্থ করে গেলে ওটা ডেল্টয়েড আছে মুখস্থ করতে হবে, কিন্তু বাই দ্য টাইম ইউ সিইং এটা চলে গেলে নেক্সট স্টুডেন্ট দেখলে, আই এম ট্রাইং টু সে দ্যাট আফটার সিইং দিস, তুমি ধরো একটা কার্ডিয়াক মাসল, হ্যাঁ, then what is it? You just go on. Now your syllabus is such that you have to correlate. Now, introduction. Histologically, the muscles are classified into 3 groups. এখানে দেখো how things are made easier for you. Now, the viva, it will be in viva. এগুলো আমাদের in our time it was not there. কোনটা ভাইবা কোনটা কি জিজ্ঞেস করবে, ঠিক আছে? Now it is to the point, you be very focused. 8 months in your hand, 8 months, beware that 8 months এর মধ্যে তোমাকে অ্যাপিয়ার হতে হবে, আর 4 মাস গায়েব। Now the skeletal muscles, cardiac muscles, smooth muscles. Physiologically, muscles are classified as voluntary, skeletal muscles, under control of our will, and involuntary, cardiac and smooth muscles, not under your control. So, voluntary muscles and involuntary muscles, these you have to know. Now, voluntary, I'm at a nacher pose korlam. Now, this, or I'm at a gym করছি, এরকম করে জিম করছে, এগুলো দেখাচ্ছি, Pritam sir is doing a gym and he posts the Facebook, and our Vivek Malik, he is in the gym, trying to pump in energy, muscles. But what I would do, those who are planning to do gym, that definitely health fitness is there, but don't drink that. You get protein drink and all, Amazon order korle tarpore digle vitamins fele dile, don't. Okay, now you just say histologically it is the skeletal muscles, cardiac muscles, smooth muscles. Physiologically, muscles are classified as voluntary, it's under your control, and best is your voluntary muscles. You see any dance, and one thing I tell you, that is the dance music, the drum is more or less the same rhythm. The African drum, the African people, and the Sonajuri heart in Shambati Canal, our tribals, they are in the same rhythm. That day I saw in the Facebook, different places they are having the dances. So different ঘটনা, যে Kathakali, Odissi, your Kathak, and today's modern dances. Now this is a very specific muscular control at will. Similarly, any game, from football to any game, at a ball is coming, and Virat will planning how he will swing, or he will just do this. Now, this is the integrity and the control of the brain controlling the muscle. How much to go and with a stroke, or he will out and out hit. That means every muscle is having a voluntary control, it is under our will. Like you are doing surgery, you open the abdomen, slowly you open this inside the skin, and slowly by layer you will go. And you won't be in a hurry. Now you are doing, some of you might become a plastic surgeon. Now you have to repair the cleft. So you see the labial muscles, the muscles of the face, muscles, you have to see how much it is your incision, your movement of the hand and your fingers is an art. So this is controlled, is under your will. You can control it. And you can stop. Our heart, don't say. The day it was when you organogenesis, when you read embryology, organogenesis, the organs are being, now you will see, you do an USG at 6 weeks. There will be gestational sac, as I say, but there is no cardiac pulsation. So they, means a woman comes with a missed abortion, spotting. Now you order for an ultrasound. You go, then they'll say repeat scan after 2 weeks or 3 weeks. Now you have to, now by that time cardiac pulsation will come. So that will be a rhythm there. So now that is being controlled by nature's play. Next. Now skeletal muscles also called striated muscles because of striations, voluntary muscles under will. Okay, because of skeletal attachment responsible for locomotion, what I told you earlier. Visceral striated muscles, microscopically identical to skeletal muscles, confined to the viscera such as tongue, pharynx, peripheral part of the diaphragm and upper 2/3 of the esophagus. Now this again comes in the viva. Now involved in speech, breathing, swallowing and coughing. Now visceral striated muscles microscopically identical with the skeletal muscle, confined to the viscera such as tongue, pharynx, peripheral part of the diaphragm and upper 2/3 of the esophagus. Now tongue. You can play with the tongue in different ways. Yeah, like when I examine a patient, I say, Ma Kalir muto jibta dekha. Boro. Okay. Now, even the length of the tongue differs. And you can make different shape and this thing. So, when we read tongue, we'll again discuss. Now, involved in speech, breathing, swallowing and coughing. These muscles is the speech, breathing, swallowing and coughing. Next. Now, histology of skeletal muscle, identification features. Skeletal muscle fiber is a multinucleated syncytium of varied length. Each muscle fiber is elongated, unbranched. See, peripheral nuclei, transverse serrations, muscle fiber, and connective tissue with blood vessels in between. So this muscle, when you dissect, you will see the major arteries with branching, with supplying, and in between that is this thing. You find your arterioles and these things are there. Now you have to be very delicate. Not a trauma near a trauma, badly injured muscle, badly injured your bone. Now that day I showed you with the elbow joint video. Now you have to handle tissues, I tell you, very gently. And you try to immediately, one person comes with the thing, the main basics of the emergency is that you try to stop the bleeding. Now you have to, either you tie a tourniquet first, Because by the time you see an X-ray and this, that, first resuscitate the patient. And then you go for the, because your radiological investigation, that takes time, and moving from one ward to one place, there is catastrophe and there might be death. So try to identify the bleeding points in the emergencies, the thing you tourniquet and get the things repaired, and then you, by the time blood transfusion form, your IV infusion, everything goes in. So patient becomes stable, you go for a portable X-ray in the ward or the emergency where you are handling. Okay, then you can get the, how much bone is involved in this? Fracture or just a twist or multiple fractures. Then accordingly you manage. And now the nuclei are flat and located in the periphery of the cell just beneath the sarcolemma. Now photomicrograph of skeletal muscle longitudinal section. See the muscle fiber, endomysium, muscle fascicle, pedimysium, muscle striations, peripherally flat nuclei, dark eosinophilic cytoplasm, going to myofibrils. This is 100x, this is 200x, this is 400x magnification. Now again, fibers show transverse striations of alternate dark and light bands. Dark band is called A band, a light band is called isotropic band because of their power of refract the light in polarized light microscopy. Now this is a special microscope, polarized the light, and that can be viewed in a polarized microscope. And connective tissue of the skeletal muscle is endomysium, is a layer of reticular fibers. Pedimysium is a cover of bundle of muscle fascicles. Epimysium covers the entire skeletal muscles. Now, these types of skeletal muscle fiber based on the diameter and color of the muscle fiber types red, white and intermediate. Red fibers, type 1 fibers are slow oxidative fibers. Intermediate fibers, type 2 fibers are fast oxidative fibers. White fibers type, based on appearance in the fibers in the body and not in age in stain. Just know it, just know the difference between red fibers and white fibers. You have to read. Nerve supply of the skeletal muscle. Now this will be in physiology, more or less in physiology it will be taught to you. The motor end plate, muscle spindle, motor unit, even will be teaching you. See, this is a beautiful picture, and this, when you read physiology, they will tell you neuromuscular junction, motor end plate, clinical correlation. Now, myasthenia gravis, an autoimmune disease that antibodies found against acetylcholine receptors. These antibodies damage progressively acetylcholine receptors and muscles slowly become weak. Neurotoxins, many snake venoms contain neurotoxins that bind the acetylcholine receptors. It may cause paralysis of the respiratory muscle and death of the individual. Stretch reflex, it is a myotactic reflex elicited by a blow upon a muscle tendon that is in reflex induces muscle contraction, example biceps reflex. Now, you any patient says that she is having weakness of the right hand or right upper lip, then you routinely just the bicep tendon, when you go to the clinics, you will get a hammer, rubber hammer with a, even inside there is a pin in the this thing you open. Now with the when you want to get a reflex, the tendon, a knee reflex, you just above the in the knee reflex, you hit, it will go like this. Or like in routine diabetic patients, in routine your patient comes with a stroke, cerebral stroke, CVA, is like this, okay. Now you take a quick examination of the plantar reflex and your the reflexes of the which side it is affected, but you have to see both sides. মানে তুমি বাঁ দিকটা এরকম পড়ে আছে, ওটা দেখে ছেড়ে দিলে তো you make it a habit, see the normal side and then you see the affected side. And in diabetes I'm telling you, because diabetic neuropathy, especially in the lower limbs, and you have to see all the reflexes. Like in those days in our college, Professor of Medicine, Professor Prodai Mitra, he was from Calcutta, which is now Barakpur, become Calcutta, and Shodhpur. He used to come to Bardhaman to teach us, and it was his routine practice. Oh, patient reflex gulo dekhbe, ankle jerk, knee jerk, and your plantar reflex, you will see. It's routine. Now, I have carried on this. Anyone comes with a complaint of any like uncanny sensation of the when he's walking or he's having some difficulty, then I take it as a quick checkup. মানে এটা তোমাকে মানে ব্লাড প্রেশার এগুলো সব দেখবে 5-7 মিনিটের মধ্যে দেখে নিতে হবে। Just a scan, and you are having gadgets. Okay, now cardiac muscle. Now the cardiac muscle fibers are located in the heart. They show following peculiarities: auto-rhythmicity, contraction on the without any stimulation. Hence, it can work as pacemaker. Shows cytoplasmic striations supplied by autonomic nervous system. Sympathetic stimulates, parasympathetic inhibits. Sympathetic stimulates and parasympathetic inhibits. Cardiac myocytes are connected to each other by densely staining cross bands called intercalated disc. This is the marking. Cardiac muscle also shows striations, but it is involuntary in action, striated involuntary muscle. Cardiac muscle shows less number of myofibrils than skeletal muscle. Hence, striations are less prominent in cardiac muscle fibers. Cardiac muscle fibers accommodate more amount of sarcoplasm and mitochondria. Now, mitochondria, these muscles are only when you are voluntarily doing something. The difference, the cardiac muscle is having more mitochondria, it has to have more energy. So, the muscle is always pumping. The pulsation at the earlier phase of organogenesis, I'm not counting those periods, but I'm saying once the child is born, the first cry, or it is having it has a difficult normal birth, then you just pump. And in those days where we didn't have ammo bags as such, or some this thing, we used to put a small piece of gauze and mouth-to-mouth respiration for the child. বাচ্চাটাকে ধরলাম, মুখে একটা গজ পিস দিলাম, blow. So similarly, the cardiac thing is that it cries. Okay, now histology of cardiac muscle, you see branch muscle fibers, intercalated disc, capillaries, nucleus, perinuclear hub, and fibroblasts. Now, next, smooth muscles, elongated spindle shaped, transverse section, longitudinal section. Now you see the smooth muscle fibers, longitudinal section. Now this is the blood vessels in between this, and transverse section it is in this. Okay, we'll show you. The photoparticle of smooth muscles. Okay. Now, one thing, the way we are working, group. Huh? এই ফ্রেমটা দেখো, এত এরকম করে দেখবে, এরকম করে, আর তোমার নাকের ব্রিজটা বুঝে ইয়ে করবে। হ্যাঁ, you have to look into your microscope like this, and you take your fine adjustment. দেখো এই ফাইন অ্যাডজাস্টমেন্টটা, actually fine adjustment, it will differ from each person. তোমার লেন্সের পাওয়ার অনুযায়ী একটা জিনিস, and you keep your hands free and hold the microscope like this and look into it. And here is the left hand, you can control the light. A small circular regulate this thing, it can make the light, control the light. And this is the stage, you can just go up and down and scan. You see the smooth muscles of the ilium, খুব সুন্দর, দেখে নাও, তার সঙ্গে গ্ল্যান্ড সব দেখো, হাত ফ্রি রাখো।